Hi, good afternoon and good morning, everybody. My name is Raj Kapur. We are looking forward to getting started with the webinar in a couple of minutes. So I'll give everybody a 1 minute warning before we get started and allow some people to join. Awesome, people are joining, which is great. If anybody wants to, through the chat, just to make sure we know it's working, maybe you want to just say a quick hello or where you are calling in from. That would be awesome. All right, well, Dr. Delegati, let's go ahead and get started. Welcome everybody to today's webinar. My name is Raj Kapur and welcome to Coping with Coronavirus, Mental Health Challenges for Healthcare Workers on the Front Lines. So this session is intended for healthcare workers and their loved ones who are going through an extremely challenging time right now with coronavirus. We know there's many things going on and we really appreciate you guys taking the time to log on for our webinar. I'm excited to present to you Dr. Andrea Delegati. As a little bit of background and housekeeping, my name is Raj Kapur. I'm the Managing Director of AND Marketing, and I'll be your host for the day. All participants will be on mute, so you guys can hear the presentation very clearly. If you have any questions, please feel free to use the chat, and I will sprinkle in questions as they come in. You're not able to speak, but you can certainly use the chat. We can go back and forth, and I'll be monitoring that throughout the conversation. You'll have the, we'll take questions throughout, but in particular at the end, we'll open up the conversation for more types of discussion. We encourage any sorts of questions that you guys have. This is for all of our healthcare workers and their loved ones. It's now my pleasure to introduce Dr. Andrea Delegati. She's a licensed psychologist and mental health expert. She has decades of experience helping clients manage stress, implement change, and reduce conflict in the workplace to maximize their potential. We are hoping to share some knowledge based on her experience and answer any questions that you have in this particularly trying time. So let's get started. Dr. Delegati, let's start with a broad question. There's been so much talk about how this crisis is impacting everybody, people in general, and the general public. But how do you feel healthcare workers and first responders are uniquely affected?
Thanks, Raj. I really appreciate being here today. I think with our general population, right, for all of us, there's the stress of trying to maintain our health. We're talking about social distancing, stay-at-home orders, wearing masks in public, working remotely. I mean, we're all going through this at the present time, but with healthcare workers, I think there's an added layer on top of that. Most healthcare workers continue to work, but they're working within the context of perhaps not having adequate protective equipment. In some places I'm hearing there's minimal employee monitoring of symptoms. They may have lack of space for social distancing, even when they're in a more relaxed mode. And then there's the ever-changing guidance in terms of protocols and procedures and those kind of things. So I think that's an added layer of stress. On top of that, because these folks are not getting to work remotely, everybody's suspected of being infected. And at this point, there's no foolproof way of knowing who is and who is not safe to be around. If you work in a hospital as a physician or a nurse, pretty much all elective procedures have been canceled. You perhaps have been given a crash course or a refresher course in acute care and then transferred to another unit. So perhaps you're dealing with work that is unfamiliar to you. Even if you're working with similar populations that you've worked with before, like if you worked on a cardiac care unit or a cancer unit, now we have the added risk of these patients perhaps also being infected that we know of or that we don't know of yet. So I think that being in unfamiliar work situations in acute care, if that's not where you've worked. I've also heard that canceled elective procedures has resulted in some team members in hospitals being furloughed or laid off. The folks who are then being transferred over to acute care have mostly been prepped and waiting for a surge of patients. And if that hasn't happened, then what we have are physicians and nurses who are used to being very, very busy people. All of a sudden, they have a lot of time on their hands and no work to do. So you're really left alone with your thoughts. And given the constant flow of information, many times those are not the best thoughts to be left with. So too much time is a challenge. If you're a nurse, right, all of a sudden, if you need to respond to a patient calling for help, you usually would just run into the room and provide the assistance. Now whether you're putting on masks and gloves and gowns and going into a patient's room, that's a lot of extra steps before you can get to the patient. And not only that, but then you have to take all of that off and maybe put it on all over, new stuff on before you go into the next room. Lots of extra steps for folks to have to get their head around because it's out of our routine, and now it's becoming kind of a new normal. I also think if you're dealing with the more significant protective equipment, depending on where you're working, it is miserably hot equipment. It is physically hot and uncomfortable. It's abrasive to your skin. It restricts your senses and certainly creates barriers to communication with your coworkers as well as to your patients.
Boy.
I can just go on and on. I'm also thinking about.
That's a lot. That's a lot. There's a lot to unpack. So maybe let's as people are still joining and some questions are coming in, let's try to unpack a little bit of that.
Sure.
Let's start with the most important one, and that is stress. So you have decades of dealing with some of the most complicated types of psychological issues. What are some of those signs of stress? And for that healthcare worker on the front lines, what are the best ways to sort of manage that stress as much as possible? It's a unique time, and most people have never been through things like this, but what are your recommendations on specifically around the signs of stress and how they might work to resolve them?
Sure. I just want to put names on things for people, because a lot of times when we talk about signs and symptoms, we don't necessarily even have the vocabulary to explain it. People hear about anxiety, but what does that mean? We're talking about worry. We're talking about fear. We're talking about a feeling of loss of control. We're talking about obsessive thinking and maybe compulsive behaviors. For healthcare workers in particular, I think there's a feeling of dread as to what's to come next. That's all under the purview of anxiety. But then you have depressive symptoms as well. So that might appear as feeling sad, feeling lonely, negative thinking, irritability, anger. And again, for healthcare workers, powerlessness as a helper, feeling like you can't do enough to help other people, or that you're waiting and you don't even have the work to be able to implement your skills. Other signs of stress, the physical symptoms such as the sleep disorder, can't fall asleep, can't stay asleep, appetite disturbance. But now the other piece of symptoms that I believe will be much more prevalent in healthcare workers are trauma symptoms. And for many of the first responders, folks working in an ER and things like that, they're used to handling trauma and they have some ways of dealing with it, which I'm going to go into in a moment. But things that are trauma related are things like maybe there's a recurrent visual image that you can't kind of get out of your head, or there may be a sensory experience. It might be a smell or a touch, a sound that just keeps coming back and recurring and reminding you of a very difficult situation. You also could be sitting on the edge of your seat all the time, or you could be sitting there relaxing and all of a sudden you have a momentary, you're back into this very stressful, traumatic situation. And if you've lost somebody who's been very close to you, a coworker, you then can also have what we call survivor guilt. Why them and not me? You know, they had everything to live for. I'm older. It could have happened to me. I'm more at risk. Those trauma symptoms, while typically in healthcare, we have the resources and the defense mechanisms in place to allow us to deal with trauma in a very short term, like a situational crisis, and then we move past it. The longer this situation goes on, it becomes a chronic stress. And if we're not dealing with these symptoms as they come up now, they're going to come back. They always sneak back up on you afterwards. And I think that's the biggest challenge now. So I guess to go back to the easier symptoms, number one, just being aware that we have symptoms, aware that these, what I just mentioned, all of these symptoms, they're signs of stress. We're all under stress. Healthcare workers have them a bit more. So one is an awareness. The second thing is to articulate, to name what you're feeling, name the stress, try to talk about it with the people who are most supportive to you. As coworkers in healthcare, we're together, so you can support each other. You can find humor in little things. You can check in with each other. You can share a meal. Downtime, share some thoughts. How's it feeling? You can also help each other distract from the pressure of the moment and kind of take a conscious break, just to give a little bit of space, just a relief valve. If you would think of like a pressure cooker, where you just have this little relief valve that you push, and it just blows off a little steam, just to allow you enough resources to kind of get back to work. While managing stress is important for all of us, I think for healthcare workers especially, self-care is vital for us to be able to continue to do our work.
So again, there's a lot there. I mean, you're talking about some extremely severe things. So talk more about self-care. If I'm a healthcare worker or a doctor or somebody on the front lines that's dealing with this, sleep disorders, appetite, visions, bad dreams, all these types of things that you're talking about that are really severe and traumatic. If I see those in myself, what would you recommend I do about it? I mean, there's certainly being aware of it. Certainly there's finding releases. But some of these are like red flags, Dr. Delegati. What would you do if you felt a red flag in yourself, and what's the action you should be taking? Because bringing awareness is one thing. Let's do something about it.
Right. And so specific things like I think some of this stuff recedes a little bit as you start to talk about it. And again, talking about it with a friend or colleague, that is easy. It just gets it out. It makes it real. It takes it out of us thinking there's something wrong with us, or there's something different about us compared to other people, because everybody's going through it. So that it's almost like a little reality test when you're able to say something to someone else. If it gets to the point where it's truly impeding what you're able to do, then you start to reach out to somebody else for more professional help. And for the most part, all mental health professionals are considered essential personnel. We're all here and ready and waiting to help. We're a phone call away, an email away, and you can do that. There are national hotlines if you'd like to talk. There's local hotlines, crisis intervention lines that are available 24/7. But you have your private practitioners, and most hospitals, most organizations, usually besides medical insurance that'll cover mental health care, many places have like employee assistance programs there who offer very short-term, usually 3 to 5 crisis-oriented sessions, and then they refer you on to a mental health professional. That's what I mean. There's so many things that are at your fingertips that you can reach out and ask for help. But you know, Raj, the biggest challenge for healthcare workers, we don't ask for help. We're so far into helping everybody else. We kind of just keep going and going and going until we can't go anymore. And that's a real disservice, not only to ourselves, but to our patients, because we take ourselves out of the action and out of the ability to help if we're not taking care of ourselves.
It seems to me like this is the most important person you need to take care of. It's sort of like the the airplane rule, like take care of your own seatbelt first before you can take care of others. I think it's an
Yeah,
important.
the oxygen, right? Put the
Yeah,
oxygen on first.
absolutely,
It
absolutely.
has to happen, has
So,
to.
so I'll just remind everybody that the chat and the question box are open. Andrew, I'll give you a moment to take a quick breath. So the first question that we're getting in is, who should we trust, given that information coming out is often inconsistent, even from inside my own organization? So I would imagine different departments or something like that are providing inconsistent information, let alone the news. I mean, I'd love your reaction to how do we decide who to trust when we're getting inconsistent information?
I think this has been the biggest challenge throughout this crisis. What I'm telling people is you need to pick a couple reputable news sources and stick with it. And when it comes to government, I can tell you what I go to the CDC for information, but I also go to my state health department, and I also go to my local a county health department, and I look for statistics. I look for their guidance. They're the sole source of information about what's happening in my community and around me. I also think that folks tend to surf the internet looking for information. And what I can tell you for sure is social media posts are not good. Everyone should be aware of social media posts because anybody can put anything on a social media post. If you're looking for facts, what I usually tell my clients is please go to a website that ends in .org or .edu, because those are probably the places where you're going to find vetted facts and information, as opposed to someone's opinion, which may or may not have grounding in any reality at all, in terms of what's on social media. So I think that's important. The other thing I ask people to do is they need to turn off the constant news stream. Pick your favorite station on whatever media you'd like to listen to, and it goes on and on and on over and over again. In the old days, and I know I'm dating myself, we had the news in the evening. You turned on the evening news, you watched it, and then you turned it off. The 24-hour news cycle is just ratchets up the anxiety. And unfortunately, because with this, the stories related to this virus, information it's fluid, it's happening. We don't know a lot of the information, and the stories keep changing hour to hour, day to day. And we really I don't know, I don't think we need to be a part of that process of everything changing, because it just gets us, we go up, we go down. We don't need to do that to ourselves. If you listen to the news first thing in the morning, listen to the news in the afternoon or in the early evening. I just advise folks to please not watch the news right before you go to bed. Please don't leave the news on while you're trying to go to sleep. That will keep you up in and of itself. Just check in with it, and then trust that information with regard to the broader issues going on.
There's a certain bit of irony. I mean, I run a marketing company and we do social media campaigns, but I cannot possibly agree with you anymore that your neighbors and friends and all your, your uncles and all those people who are giving you all those posts and feeding you this information, it is certainly overwhelming. So I've actually put myself on a social media diet during this coronavirus craziness, and I felt, I've immediately felt better. I felt slightly out of touch, but that has far dominated me to be able to go focus my mind on other things that I can, more things that I can control.
I actually, if I could just mention something, I actually find myself, because I'm checking these particular sources and I have contact with various folks in healthcare, I've gotten to the point where I've asked them, would you like me to share this information with you? Because I thought, I don't want to be the one also jamming up people's boxes with, even though what I think is vetted material, I don't, if that's stressing somebody out, I don't want to do that. So I'm asking permission to send that out.
Yeah, that makes a lot of sense, because it goes both ways, from the giver and the receiver. You're absolutely right.
I think so.
Drill down a little bit more about the internal dynamics that happen in hospitals. So there's part of it, you answered the external question really well, but the internal part of it, we've got another correlated question that says, I work for different organizations and different roles, but I might be getting inconsistent guidance. And just anecdotally, what I'll provide to that is one of my friends is a frontline healthcare worker, and even with regards to PPE, which you talked about a little bit earlier, guidance on what is current best practice versus what was a typical best practice maybe months ago before this all hit. How do you deal with those internal conflicts potentially? I mean, that's a really hard question. I suppose it's not answerable, but I'd love if you have any thoughts there.
Yeah, I mean, it would be great if we all had consistent guidance on how to handle this situation, be it in the hospital or any of other facilities. Because I also want to say something before, because besides hospitals, I think the other thing we have to acknowledge is we have folks in nursing homes, personal care homes for the elderly. We have folks working in residential facilities, group homes, community living situations that have that are set up for folks with maybe intellectual, psychiatric, or actual physical disabilities. So we've got frontline staff at these organizations as well. And I also think that there are people who work who, for example, you know, somebody who's a first responder, who's a police officer, who's picking up shifts as an EMT, you know, in the next borough. Or you have somebody who's an ER nurse who's also running shifts as a paramedic for the local firehouse. So there, healthcare workers, you know, helpers like to help, so we help in whatever situation we can. And different organizations will approach the issue in different ways. But I think there's a reason why we don't have consistent guidance. One is because this virus is so new, and we've never even had an epidemic in this country for 100 years. So we're not used to dealing with that. And then a second thing is we're really learning as we're going along with it. So the information is changing and the guidance is changing. And yes, one source of information, I have to tell you, I really like the CDC's website because they have a section for healthcare providers, and they have it separated out into subgroups. So if you're a first responder, there's a section for you in terms of best practice. If you work in a hospital, there's a section for you. If there's another one for a nursing home. So I recommend that folks check that out. And I think we'll have a slide on that at the end with resources for folks with the CDC, but just know it's the CDC website and it's for healthcare providers section.
So and just flash that for the audience so they see those bullets that you put up there, the sites.
Perfect. Perfect. And all right, so that's back to different organizations and different rules, right? You have a job with an organization and you are expected to follow the rules that are imposed by your employer. That's what we do, or else we lose our job. So, but what I say to folks is we're professional healthcare workers. So you need to educate yourself in best practice. So gather information, go to the CDC, see what they're recommending at any one time. Consult with experts and colleagues in other organizations, because what you find is that there are some organizations that are under an umbrella and that different sub-organizations are handling things differently. So why should this part of the organization have, you know, rooms for isolation of COVID patients, and this organization under the same umbrella have something totally different? That's a disconnect for people who are trying to think through what is the best practice as we're trying to put things in place to deal with our patients. So I think educating is first, consulting with other people, and then I think if you're going to have a conversation with a manager, your manager, is you do it cautiously, and you're going in to be helpful to them. You are going to say, oh, I was noticing that when I was reading on the CDC website that they say blah, 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 and what do you think about that? So you're approaching your manager with trying to help with a solution. You're not kind of attacking them or accusing them, because I think we need to put ourselves in the shoes of folks who are making decisions, right? Administrators are administrators, and a lot of times they're not doing direct clinical care. So we might have some insight from direct clinical care that they could use. But these folks have been under so much pressure to put things in place so quickly. I think if you approach it the right way in a wanting to be collaborative and helpful, I think these folks will be open to constructive feedback. I actually have one client who actually did that. And when she took the risk to go to her administrator, the administrator said, I've got so much on my mind. I am I'm so distracted. So thank you, because I wouldn't have thought of it that way. So I think it's the opportunity, and again, we're creating as we go along in this crisis. So information is good, but please do it in a way that that you're not setting yourself up for failure or for backlash. You're trying to be helpful and caring as you go
And I
forward.
think there's a leadership lesson inherently in there, because what you're kind of, especially that last bit where, leaders want a feedback loop from what's happening on the ground level. They're obviously just human as well, and they're doing the best that they possibly can with information from multiple sources. And so that feedback loop from the absolute front lines is probably really important in terms of, communication and transparency and things like that. So family has come up as a couple of questions on here. So here's a good question here. There are many worries about personal and family safety, especially for people who are around patients and in the emergency rooms and dealing with, all of these really stressful dynamics and potentially hurting their families. I guess the question here is it an overreaction? But maybe more broadly, how should healthcare workers be thinking about this, and how should they be handling themselves in these, family situations? Because certainly healthcare workers don't want to get their family sick too.
Right. So I don't think it's an overreaction. I mean, healthcare workers, just because of the nature of the business, they're going to be at greater risk for being in contact with sick people. And precautions are necessary. And anybody who's worked in a hospital, they know we have trainings and universal precautions every year. We have our little reminder that we have to follow those precautions. I think the difference with this virus is that any of us can unknowingly carry it into our homes. And so just like we're disinfecting just about everything we're bringing into our homes currently, if you have a delivery, we're wiping everything down, or we're wiping surfaces down when we're out in the community in terms of that ATM. We're making sure that that's all, disinfected, wiped down. So I think added care is needed. And depending on the level of exposure or potential exposure, I think that can guide folks. So, for example, I know some folks, some physicians who sequester at their job. They don't want to go home. They're afraid of taking things home. So they're just like locked down at work and staying there. Other folks are coming home, but they're self-isolating in their home. So they're living in the makeshift garage or the basement or the laundry room, but they're keeping themselves separate from their family because they feel that that's the best way that they can protect them. I have other folks who are trying to keep things as normal as possible, but normal now means, taking the shoes off before we're walking into the areas where the other where family is. They are disrobing in a designated area. They are showering. They are throwing laundry in before they even have any contact with family. So those are just kind of, that's how varied it is for different folks and what works for you and what works in a particular family situation. And I think they're always juggling what's going to keep the family safe, what's going to not be an overreaction for the family, because different families and different people in families are going to have different tolerance level for risk. I've actually even heard of some organizations that are not monitoring employees who are coming and going in hospitals. They are, they basically have put the staff on a, kind of an honor system to self-monitor. And I think that's a risky behavior because, again, we don't tend to think of ourselves as getting sick. We're super people, right, in healthcare. So I think what I liked, what I heard is some places is actually creating a bit of a buddy system and an accountability system where folks are monitoring each other coming and going. So taking temperatures at the start of a shift, at the end of a shift. I think healthcare workers always, should be monitoring themselves anyway, because if you're sick, you shouldn't be going in to be at risk to other patients. And I do believe that healthcare workers and first responders continue to be designated high priority for any testing to be done. So hopefully that's happening, that there's enough of testing equipment out there that folks are able to get the tests that they need.
Yeah, and back to the variable guidance that people might be getting, I think there's an inherent message there that says that even if your employer or your hospital or your facility doesn't have strict guidelines, that doesn't mean you shouldn't be abiding by the strictest guidelines, because an abundance of caution is probably really prudent. And be the change you seek in the world is like not more prevalent than if your employer doesn't have any formal systems. Is you got to really police yourself, police your coworkers, I would imagine. Any thoughts on that?
Yeah, I absolutely agree to that, because I'm just going to throw this out here because it's been on the news lately, this whole thing about opening up places. So that's been in the news this week. And again, I'm just sitting here thinking, well, we can open things up, but are people going to actually be out there going to the businesses? Because we are responsible for ourselves. And I know that that's what we're saying, but we truly do have to be responsible for ourselves, for the protection of our lives and for those who are near and dear to us. Yeah.
Yes, an abundance of caution, especially from our healthcare workers. I think absolutely. You might have been sneaking on Facebook or social media to get some of your references to some of that stuff. Anyway, the next question that came is, given the physical and emotional exhaustion, do you have any tips on how to remain calm in this crisis situation, whether at work or at home? So I think healthcare workers are seeing it on both ends, either exhaustion when they get home or physically they've been working too many hours.
True. So let's just own, again, we're all under the increased amount of stress and information overload. And even if we're a healthcare worker that has not been particularly challenged at work, so we're not working long shifts or more intensely, just the level of stress is wearing us out and taxing our immune system. When we're in that overstressed situation, I guarantee you there are going to be more perceived crisis situations than there actually are. And I can tell you, based on the number of phone calls I'm getting, my husband's working in the next room, and I can tell you, and he's an IT guy, everything's a crisis with everybody working from home. And it's like, whoa, this is just normal kinds of glitches that happen, but everything is blown out of proportion. So what I tell anybody who comes in and is talking about crisis, I say, first thing you need to do, breathe in some long, slow, deep breaths. Make sure you release all the air in your lungs so you don't hyperventilate in the process. And try to focus just on breathing, just like, wait a minute, and just try to breathe. And guess what? When you're doing that, it's really hard to talk when you're breathing. It's also allowing more oxygen to get to your brain so you can think a little more clearly. And if you're doing that, there's less chance that you're going to say something that you regret. So let's start this part of the crisis. Let's not create more. Let's just take some deep breaths. You can delay a response and just say, give me a minute. I need to catch my breath. Actually, you said that to me, Raj. You said, let me let you catch your breath, Andrea.
Sure.
If you're at home, what I'm going to tell you is, if you go and somebody's very upset at home and you're trying to say, can't talk about it now, they are going to get irritated with you because they're going to think that you're not responding to the crisis that they're feeling. So with those times, if it's at home and if you can do this and say, you know what, I really can't process that right now. Can we talk about this later and pick a time, after dinner? Can we talk about it after the kids go to bed? You're trying to delay the response to just give yourself some time to collect yourself and have a more clearly thought through reaction. Now, if it's a real crisis and you don't have that luxury of time, what I say to folks is do your best to give a logical response, recognizing that logical response can come out sideways and cannot come out necessarily the way you would like or intend it to come out because you're so stressed. If that happens, the goal would then be to go back and debrief afterwards with the other person, because again, the big goal is to maintain relationships and open lines of communication. And sometimes we can all say, oh my gosh, I was really sorry, I was so stressed I couldn't even think straight.
That totally makes sense, and everything is heightened at this time, so emotions certainly run hot in everyone, especially healthcare workers, I can only imagine.
Judy,
Yeah.
but just one more thing. I just in thinking about this as well, that, I mean, when we're talking about a prolonged period of stress and how it taxes the immune system, if you stop and think about this, if we're talking about physical and emotional exhaustion, one of the ways to reduce how much physical and emotional exhaustion is to take care of ourselves. And, you know, I can go down the usual proper rest, proper nutrition, physical exercise, socialization. And I'm going to tell you, healthcare workers are notorious for not getting proper rest, proper nutrition, exercise, and socialization because they've been so keyed up and always running on overdrive. So that's back to the most basic of taking care of yourself, taking care of your immune system, and lessening the impact of the exhaustion that just comes from the added stress that we're under.
No, I mean, you said those things are basics or fundamentals. I think they might be, but people need a reminder, especially as crazy as it gets, to go back to those. And again, Andrew, I'll give you another moment to take your breath, and I'll just offer to the group any further questions. I'll do a last call for questions in the chat box or in the Q&A. We do have a couple here in the hopper, and I will go through these, and we'll keep going for a few more minutes if you're up for it. This next one, I'm not sure if you're in a position to answer, but I'll go ahead and ask it. There seems to be a push for more antibody testing, but there are questions about how that information will be used. Do you have any thoughts on this?
Okay, well, I can tell you I'm not a physician. I'm not a researcher or an epidemiologist, but it seems to me at this stage with this particular virus, we don't know what we don't know. And I like to say that to people in general, that we don't know what we don't know. And in this case, it's a very scary place to be, to not know. I'm not sure even if we had mass antibody testing, if it would give us the answers that we want, because I think people are wondering, oh, does that mean I'm immune? Okay, if you're immune, all right, that's great. But for how long? Does that really make sense? How long is that? We don't know. I was actually kind of excited to hear something about plasma transfusions helping people. That was on the news today, and I thought that's pretty cool. That's good. It's another step along in the process. But what we really need is a vaccine to keep us all safe, and I don't think we're close to that yet. So I don't know how all this information is being used. And I'm going to tell you something that I also read about. I think it was in the Sunday paper. They were talking about an app that you could put on your phone for people who had recovered from coronavirus. And they were talking about like tracking people's whereabouts.
Whoa.
And you know, to see about spread and people they came in contact with. I don't know. It was an article that I read, and I was like, once again, all of this is amazing stuff coming out of this in terms of being creative and how to deal with things. But I don't know if any of this stuff is giving us what we want, and which is we want to be safe, we want to be secure, and I think only a vaccine is going to give us that. I don't know all the steps we're going to need to get there, so I don't know.
No, that's great perspective. Here's another question, Andrea. So how this is from a frontline healthcare workers family member, and as a family member, how do I support my husband, and I would imagine wife, whatever the relationship is, how do I support them best when I'm not on the front lines and they are? So what advice would you give to family members who are dealing with this level of stress at home and have to, provide as much support as they can, I would imagine?
Yeah, again, my favorite answer is going to be listen. It's as simple as that. If we can listen to what people are saying to us, we can hear what their need is, and then it kind of helps to guide our response. I think that if you listen and you're not hearing anything, right, that's a problem in itself as well, because is the person then withdrawing? Are they socially isolating themselves and not talking about it? So then there might be you might just respond to what you're noticing as the cue, the nonverbal cues. Like, you seem so distant from us. I can't imagine what kind of day you may have had. And
Yeah.
it's just kind of an acknowledgement. It's a listening, it's kind of noting, and I can't say enough about noting the nonverbal cues, because right, we communicate probably 93, 95% of what we say is not what comes out of our mouth, it's what we say with our body language.
Sure.
And so I think that's really important to do.
And I would imagine, like other things, quite often your loved ones are the ones who are going to notice the red flags when you're too busy, not noticing them, not taking care of yourselves. So maybe this is a call to action for loved ones to watch out for their frontline healthcare workers or first responders to be able to, acknowledge or maybe seek help or things like that.
And for them to get support that they need too, as a family member.
Yeah.
I happened to speak to someone who had, like, I think she's 7 or 8 of her family members in healthcare. And I was telling her about this webinar coming up. And she came back and said to me, she said, oh, they don't need it. They're all fine. I'm the one who's falling apart. I'm the
Sure.
one who's so stressed out. And that's exactly, so recognize that is a secondary stress on you as a support person for the folks who are on the front lines.
Yeah, I think that's super valuable and extremely relevant. So this is great, and I got a question, just a matter of task. We are recording this, so this will be made available, and we'll put it on YouTube just as an FYI for everybody. So Andrea, that's great. I think this is great, and I think I'm seeing a few people signing off here. So maybe I'll leave it up to you to have any sort of parting thoughts. Maybe you can talk a little bit about the unpredictability of this. This has been such a crazy month and a half here in the U.S. Any parting thoughts that you might want to share with the group?
Yeah, I guess the thing that I want to say is that after 30 years of being a psychologist and working in the field with people, I just know people are remarkably resilient. And out of these terrible, terrible situations, it's usually remarkable innovations and ways forward. And people just have to be able to trust that we will get past it. They have to take care of themselves, because if you're not, you can't think straight and you can't be creative in your thinking as to how we're going to get past it, how we're going to deal with day to day. And I think that the pandemic that we're all going through is stretching all of us in ways that we never even imagined would be possible, and amazing results are coming. But you can be part of that change. You can be part of creating something as you go forward. And that's the part that I guess I want people to hear. Yes, it's uncertain all around us. It's uncertain, but you have control, right? Some control day to day on the decisions you make, what you do with your day, and how you maintain your health. And that's your physical health and your mental health. And if you're at a place where things just feel too overwhelming, please reach out for help. There is help available, and you will get what you need to get back on track. I'm not talking about long-term, deep, insight-oriented psychotherapy here. I'm talking about some cognitive behavioral strategies, perhaps, to just keep you on track and keep you moving forward, because that's all any of us can do. We can't sit and wallow because, well, I mean, you can. It's even what makes it even worse than it already is. We need to kind of marshal our energy, keep our energy up, and continue to move forward and march on.
Yeah, very sound advice. And Dr. Delegati, thank you so much. So, this has really been my pleasure. I'll close with a couple of closing comments, and you can see on the slide, if you would like to get in touch with Dr. Delegati, there's the contact information. It is amdphd.com. Andrea has very kindly and graciously offered to do any sort of consultations with anybody or their loved ones, as we learned a couple of answers ago, who may be struggling with some of these issues. And we're going to send all participants a evaluation survey after this. So please give us some candid feedback on how you think the session went. We're always trying to get better. Contact Dr. Delegati with any further questions. Again, my name is Raj Kapur. If there are no more questions, Andrea, thank you so much for your time, and we wish everybody an awesome day and a great afternoon. Please stay safe and healthy out there.
Thank you, Raj, and thank you everyone for making time for us. I appreciate it.
Great.